Hi everyone, this is Dr. Rahman. Welcome to District Endocrine. Today we have our guest, Kelly Powell. She's a certified diabetes educator, and today we are going to talk about how to inject insulin. So, yeah, let's talk about that.
Great. Well, there are many different devices, as you can see, lots of different insulin pens and other things in pens, and then the good old vial and syringe. Now, I just brought a saline vial, but we're going to use it as if it's an insulin vial. So, when we talk about injections and where you're going to give them, do it around the abdomen, the upper outer thigh, the upper buttock or hip, and the upper outer arm. It's never meant to hurt, and people should really not even feel it. Today's needles are so very small, so very thin, it's a lot less uncomfortable than checking a blood sugar.
True.
So not to be uncomfortable whatsoever. If it is uncomfortable, check with your educator because they could probably teach you a couple tricks to help. I'm just going to take one of these pens and show that the insulin that comes in a pen, some of them are one insulin, some of them are mixed insulins, then we have to rotate and mix them well. You know, most insulin comes 5 pens in a box, and then you're going to want to take the 4 that you're not using and keep those in the fridge. But the one that you're using actually does not need to be refrigerated. Most of them, 28 days, a couple of the mixed insulins are 14 days. These tiny little disposable needles, always want to clean off. If it's not the first time you've used it, you want to clean off the end, the rubber stopper, connect the pen needle. Another thing we need to do every time for most pen devices is we need to prime it with a couple of units, and we just want to make sure that we see it come out the end, and there's a drop. Then I'm free to dial up the dose that's really intended, let's say 5 units. Would be right between the 4 and the 6. We're going to clean off that, let's say this is the abdomen this time. Let it dry. Stay at least an inch away from your belly button. Go straight in. These very, very tiny needles need to go just straight in. Push down. When you've pushed it all the way down, you can let go and count to 5. And pull straight out.
Right, that's it.
We can use the cap to take the needle off.
Right. So the needle is extremely fine. It's very small. There is a lot of people actually are very worried and afraid of the needles. But this needle is extremely small. Once you try a couple of times, you won't even feel it that you have given it.
That's right.
So it's not really hurtful actually. And one more advice I would give to our patients is that please use different areas.
True.
Yeah. So some people just place in one spot, and you can have some changes in your skin, and that can cause the insulin delivery to get affected. So it's better if you use different areas so that it doesn't cause the problem.
And I have had seen from across the room when I go in to see a patient, and I can see the lump or bump. They're right-handed, so they always go into the left arm, and there's a hard area that's got scar tissue there, and it does trap the insulin and really change the dynamic of what you're intending to do with the insulin. So you're right, rotation is very important, and some people choose to go like at a 12 o'clock position, and then 1 o'clock, 2 o'clock, 3 o'clock, and once they've went around the abdomen, they'll do that on an upper thigh, or Monday, Wednesday, Friday, or whatever. And when you take several shots a day, that's several rotations.
So next we're gonna talk about is insulin injections.
With a vial and syringe, again, these syringe needles are much smaller than you're afraid of, or much smaller than you're used to these days. You're gonna always clean off that top.
Right.
Again, you don't want to inject cold insulin because the person would feel it, and we don't want any discomfort.
Right.
One of the first things you're going to do is use the appropriate syringe marked to help you best. If you use a very small amount of insulin, you might have a 1/4 cc or a 3/10 cc syringe. This is a 1/2 cc, and I'm going to pull back to give 10 units. Okay, the first thing I'm going to do is clean off the top of the vial and pierce put the air in for the amount of insulin that I want back out. I always draw past where I need to so that I can flick the air bubbles out and go back up to the 10 and then pull straight out. We're going to start again, clean, let it dry. We don't want to pierce the skin with alcohol on it because it will have a burning sensation. And again, I'm all about not having additional pain. Going to go straight in, straight down, count to 5. It's important to count because if you pull out too soon and there's a bubble of insulin, I don't know if that was a half a unit, a quarter of a unit, or 2 units. And additionally, when you're on those small doses of insulin, every little half unit really matters.
And again, the needle for the injection is extremely small. Initially, people might feel the difference, might feel pain, but as the time passes by, the pain just goes away and you won't even feel that you've given yourself the shot. So it's very, very fine needle, basically.
I have a lot of patients when they start for the first time and we give the first shot together and they count and put it in and they look at me like, I didn't put it in. I'm like, it's in. So yeah, you're right. It's very comfortable.
Very fine needles. So, thank you so much everyone for watching today's District Endocrine video. This is a disclaimer that this episode is not sponsored by any of the pharmaceutical companies. This is just for patient education. Thank you so much for watching this video and please don't forget to subscribe this channel.